What is scoliosis? And this is coming here. And ankylosing spondylitis as a condition in which the spine curve and twists like the letter S or the letter C. It usually develops in childhood or during adolescence. In most cases, the cause of scoliosis is unknown, although it may be related to any injury or birth defect. In some instances, multiple family members will have scoliosis, suggesting a potential generally component. I'm a patient of scoliosis. Okay. But I do in yoga, I do most of the asanas. Huh? They will not start without doing any asana. And supporting that, rope belt therapy of BK Iyengar. Okay. Ankylosing spondylitis is a chronic inflammatory disease of spine joints, vertebrae that causes low back pain and stiffness, typically starting before the age of 40. The back pain of ankylosing spondylitis tends to improve with excessive and worsens at the night. Who are the patients usually in the society which have this ankylosing spondylitis? Divya, which are the type of patients which are having this ankylosing spondylitis? Divya,
Yes, sir. So it depends on people who lift heavy weights, like maybe construction workers or those in which the back there's a lot of pressure on that.
Arun,
Uh, I would think that maybe anybody who's doing a sedentary kind of leading a sedentary lifestyle, it's like a seated job. It's occupational hazard, you can say, people working in offices. Because I've come across most of my colleagues complaining of lower back pain, and the posture is not correct on the chair, office chair.
okay. Persons who are working in IT offices,
Yes.
they have the lower back pain because their work is toward the concentration toward the computer,
Mm.
and naturally the lower back will get stiffen up. When once it starts stiffening up, no exercises and this will make it very hard, and thereby
Yes.
the pain start developing. Now, what are the asanas for the lower back pain? So, reason for lower back pain, the common diseases are sciatica is one of the diseases. Sciatica is the one of the biggest now starting from the tailbone to the ankle joints,
Like,
leg
yes.
ankle joints. Okay. It is one of the biggest now in the human body. Asanas recommended are Vajrasana, Adho Mukha Svanasana, Trikonasana, Bhujangasana, Cobra pose, Naukasana or locust pose, Setubandhasana for lower back means Setubandhasana very good. Ardha Matsyendrasana. I think you know all this, no? Asanas and all.
Yes. Most of the names I'm familiar with.
Yes, sir. Most of
And
this. Yeah.
yeah, most of them, I even practice some of these.
Shashangasana, yeah.
I think only Shashankasan I have not practiced. Otherwise, all I've done.
Shashank is the this na from Vajrasan when we go down Balasan. It's like
Balasana, Balasana. No. Okay, okay.
huh,
Balasana is different, Shashangasana is different.
Balasan when you
that's
hold
it.
the toes.
Huh. But Shashank will be the same, na? So that rabbit
No,
pose,
no,
like
no, no.
when we
Shashangasana, you have to take the hands perpendicular like this and forehead parallel and fold the tongue.
Oh,
That,
okay. Now that I have not learned
that
because in where I go,
like sneezing, the voice comes out because Shashangasana, the rabbit posture,
mm-hmm.
okay.
when you go nearer, you can hear its exhalation.
Okay. No, but where I'm, whatever I think maybe they're teaching incorrectly or using, they
No,
are
no,
like,
no,
oh,
no.
Shashank and Balasan is the same. I
No,
mean,
no.
that
Balasana is stretching the hand, whereas
huh.
Shashangasana is bringing the hands perpendicular
Mm.
and forehead parallel. Okay.
Okay.
Uh,
Hmm.
Now, osteoarthritis is a very common form of arthritis and leading cause of disability and loss of functions in the elderly population. It can affect any joint, but the knee is one of the most affected part of the whole body in the humans. There are several risk factors for osteoarthritis such as obesity, smoking, intra-articular fractures, chondrocalcinosis, twists in joint, cartilages, and female gender. Now tell me, osteoarthritis, which is the other type of arthritis?
So
Rheumatoid,
rheumatoid,
I've heard it.
RA, rheumatoid arthritis.
What is the difference between osteo and rheumatic arthritis?
Rheumatoid is normally of the fingers and all. My aunt had it, so I had an idea. And osteo is of the knees.
Of the knees, yeah. OA is only of the knees.
Why it is known as osteoarthritis? What is the
Os-
why the joints become very hardened
The,
and start paining?
the, the fluid between the bone and the kneecap,
What is that fluid?
it
What
starts
is that fluid known as?
sinusoidal fluid, if I'm not mistaken.
Synovial fluid. Synovial fluid.
Synovial fluid.
Synovin. Synovial fluid.
Synovial fluid. So that starts decreasing along with age, and then
Why?
the friction occurs
Yeah.
with age. The friction occurs between the kneecap and the bone then. And that is when the osteoarthritis starts. Like,
So
Okay.
even
that
because of
condition
low
is known
calcium
as,
also, this will result because the
yeah,
calcium deficiency starts to happen once, like
aging
especially
with
in
age.
females, so it starts from 30s only.
Can be because of the delivery problems and all. Okay.
Calcium starts depleting.
That's why we substitute calcium after mostly endocrine glands get affected in the postmenopause stage. And that's why deficiency of calcium takes place. And that's why, when, especially in obesity,
Mm.
this starts developing. What are the precautions? What are the factors which are led in the diet problem?
A low calcium intake, vitamin D deficiency, again, not getting sufficient vitamin D to fix the calcium in the body.
And
So eating more of processed
Hormonal,
foods also.
eating more of
Processed foods. You have to reduce that
uh,
because in today's day and age, processed food has become really common. So that will also, again, that will result in obesity. That will result in this.
पहले डायल करो फोन करके मंगाओ घर में खाना
Yeah,
नहीं पकाने का don't create that bad habits in the house huh?
yeah.
However busy you are in the office
yes.
your family members should get homemade food only please
Yes, I have homemade only.
you may not have time but try to prepare in the morning keep it and then make it eat it whatever it is homemade food is homemade food second most important ingredient which is affecting the osteoarthritis in 20s and 30s we have been started taking which is the common thing which gets affected to the tongue for ladies. Pregnancy time, what is the effect? What is the effect? Imli.
Sour, anything sour, yes, yes.
That
Tamarind,
that tongue, that taste remains the tongue during pregnancy time. इसके लिए pregnancy time you take that imli and all they like it very much because the fetus start developing at a better stage. Sufficient intake of the food which you take, the mother takes, the child also gets protection accordingly.
So you're saying tamarind is not good for our health
Oh,
then?
not at all.
Okay.
When I go for marriage and all, attend the marriage, South Indian marriages and all, I avoid rasam. Rasam is the most dangerous thing. Not to take imli, but in sambar you should take kokum. Kokum.
mm.
Kokum has a little less of sourness. Very important, please remember it. And without kokum or without imli, sambar has got no taste.
That sourness is the main thing.
Second, dahi. Dahi is the second
Mm.
one. Not to keep in the fridge second day, third day, fourth day. One day is okay.
Yes.
Complete it. Second day, keep it again, third day, use it again, fourth day, use it. Little. That is a sourness. Same thing with dosa and idli.
Mm.
one day, fermentation takes place. Huh? Okay.
Yes.
Yes, sir.
So these are the diet restrictions to osteoarthritis patient. See, osteoarthritis can be managed, but
Hmm.
rheumatic arthritis is very, Parul might experience it. Parul, who is the mother,
Aunt, yeah, my aunt, my bua, she had.
uh, mother's sister,
No, no, my dad's sister, elder sister, eldest sister.
where she is?
She's no more now. She used to stay on Carter Road, Bandra, and my uncle is only a doctor. So yes, you're right. They used to have a lot of dahi at night also,
Uh,
and at night it's not recommended. So actually, she passed away after the knee replacement surgery and all that. It didn't work for her well, unfortunately. So she passed away at a very early age,
early age,
in her
what age?
60s.
What age? What age?
In her mid 60s only, about 10 years back, she passed away. In her mid 60s or something.
Taking dahi in the night is not advisable.
Yeah, not at all, not at all.
In the summer season, chance is okay.
Yes.
With Kothmir and Adrak.
Yeah.
Kothmir and Adrak.
So even hing, na, because asafoetida is very good for digestion.
Which one?
Like hing, asafoetida. My mother used to say that when you have chas, you should always put hing also. Hing.
What is Ing?
Hing. Hing. Asafoetida.
That also is sour, no? Ing.
No,
Hing only
sir.
little for
Hing too, it's good.
digestion.
It's good for the stomach, na. We add hing in everything. In
Ah,
all that seasoning, na. Tadka, what we do. We add
ah.
hing in everything. Little pinch.
Now, what are the symptoms of osteoarthritis? Present as pain in around the joints, morning stiffness, restricted joint movements associated with muscle weakness. Near osteoarthritis associated with disrupted sleep, decreased depression, increased
Mm.
sedentary behavior, less physical activity, obesity, and decrease the quality of life. Bilateral knee, osteoarthritis impaired the balance and increase the risk of fall, particularly in people with moderate knee osteoarthritis.
Mm.
Different working method for relief for osteoarthritis. Yoga mind-body intervention originated in India. Different schools of yoga such as Iyengar Yoga, IAYT or vice versa, integrated approach to yogic technique based on Panchakoshas, Hatha Yoga, etc. developed a therapeutical intervention for the knee osteoarthritis. Research has been made to implement the maximum yoga therapy. Okay, joint loosening before,
Yes, sir.
joint loosening before the yoga starts. We should do the Surya Namaskar and then it will
Uh-huh.
be joint loosening, hands loosening.
Yes, yes, yes.
Very good for rheumatic arthritis. For the knee, I'll show you afterwards. Stretch the leg, sit straight, and rotate the knee.
Yeah.
Then heat it up. Put it on the side. Raise your leg. Raise your leg. Huh? Then above the knee. Raise the leg and above the knee, heat it up. Every day, without fail. Don't think of replacement of knee.
I know my
Maximum,
aunt actually, she suffered
maximum,
a lot because of this.
maximum life after the replacement is not more than 5 to 10 years.
Exactly. I completely agree. Because she went very early, I mean, and she
Ah,
started
the people have been
osteoarthritis.
practicing yoga and all. So, ठीक है.
Mm.
You should not think and should not propagate also in this medical movement. As far as possible, advise the patient for a diet. Then, because see, this has not happened 1 year or 2 years back. This has happened over the period of 20 to 30, 30 to 40. All the diet problems and all, sedentary lifestyle, wrong time of
Mm.
food and all. Okay, so these are all the important implications on that. Because all of, nowadays, because this is I taken from a MSc book and all. Few of
Mm.
the studies compared yoga therapy with different interventions such as traditional stretching and strengthening exercise or no structural group exercise for 6 weeks and showed functional changes and improvements in the quality of life in traditional practice and yoga-based research. So this is somewhat taken from the research matter. So this is a you know higher study for you. Because all out because having studied primacy from SVSA, my mind has become research oriented. It was followed by IIT. IIT में integrated approach to yoga technique. हाँ प्राणमय अन्नमय कोश प्राणमय कोश मनोमय कोश विज्ञानमय कोश आनंदमय कोश. So annamaya kosh is the DRT, QRT and this one. Then pranamaya kosh pranic inhalation technique. Then manomaya kosh we have MSRT, mind sound resonance technique.
Yes.
Vijnana Viveka Khyati. Such techniques are there.
Yes, I've attended one session on this mind resonance with Om, that this friend of mine, the same doctor. So we had only conducted. She took up the class. She's learned it from some institute in Bangalore.
Which institute? SOSR?
Sorry, I could.
Which
Oh,
SOSR?
I'm not sure, sir. No, this friend of mine, she's learned it from the Bangalore Institute. I don't know the name of the institute.
SOSR
So
and
she take
even is mind sound
must be.
resonance technique. Even
Yes,
MSRT. Even is mind
yes.
sound resonance technique.
It was very nice. Like we had to chant Om Uma, and then softly, and then without moving the tongue, like with the mouth closed, just mentally in that same way while inhaling deeply.
Mind sound resonance
And
technique actually talks about Mahamrityunjay Japa. Om Tale
yes, and along with Mahavrityunjay Japa, yes, both she had taken, both the sessions.
I'll tell you after let my class gets over. I'll tell you about the importance of Mahamrityunjay Japa.
Yes.
It was followed by IIT intervention of SOSR reported that IIT is better than physiotherapy exercise for reducing the pain, morning stiffness, pain, anxiety, blood pressure, pulse rate in osteoarthritis patient. Yogic posture for osteoarthritis. The study was limited to numerical pain scale and state that and trait anxiety cited. Meta-analysis of yoga for musculoskeletal problems suggests that yoga is helpful for chronic pain and low back problems in older women. Study this properly. You can place yourself in Viva. They will not ask you on because therapy methods are not asked. But such type of asanas are helpful in osteoarthritis patient. You can directly say Shashangasana. Okay. Continuous practice of Padmasana and Vajrasana will delay the incoming this of osteoarthritis. Okay. Will delay. What happens? She is exited. Uttan Vakrasana, Setu Bandhasana, Parvatasana, and Ajnana Asana. Pelvic twist. Pelvic twist, lower back twist.
Sir, but Marjarasan will be, the pressure will be on kneecap, na? Marjarasan A and B, the cat pose.
No. Cat
Acha.
pose. You sit in Vajrasana because I have my experience. I cannot sit in Vajrasana. I cannot sit in dog posture also. But I'm comfortable.
Sorry, sir, I missed.
No, it's
Sorry, I missed because my net had gone.
she,
Yes, its net is up now.
Divya was asking what Manjarasan is not advisable, no? For osteoarthritis.
But
I don't agree with that. On the contrary, Vajrasana is not advisable. Then Supta
Okay.
Vajrasana is not advisable because the pressure increases as you go back. But Vajrasana, you place a small towel below the knee. So that, see, try to avoid using yoga mat. Why? What is the reason?
okay,
Why? What is the reason?
no idea
Now,
because
now,
No,
yoga
usually
normally.
with the grip.
nowadays it's a fashion to show yoga mat. Huh? Where people know, are yes, he's doing yoga.
So yoga mat is for grip, I thought, so that you don't fall or you don't hurt yourself, na?
You have a slip, then moisture gets accumulated.
Okay.
Best is Turkish towel. Why? Not even ordinary towel, not even ordinary lungi, not even saris, but Turkish towel. Why?
It will
Turkish
absorb
towel,
our sweat
Absorbing
also.
moisture.
it absorbs the maximum heat from the body. Turkish towel.
Oh, okay.
And always I have got all the towels. The special towels are there. Then Yoga Niketan has given towel for me. So many on so many occasions. Yeah, my after trunk is flooded with towels only over the period of years.
So, how do you manage the floor grip, sir? Then how do you manage because on a regular floor, if you put a towel and if you try to stretch, even the towel will not stay steady. How do you
No,
manage
no.
the?
You have to suppose you are standing in Tadasana or in the, on the toe.
Hmm,
Do not
mhm.
fall. You have to be a little careful. You may get a good grip in the yoga mat, but at the same time, it gets dirty very soon. Then washing is a
I wash it
problem.
every day.
Yeah, we
Uh,
have to
Every
wash
day
it.
I wash
Yeah,
it.
yeah.
and it's okay. It's okay. Only getting dirty and absorbing the moisture, it's very difficult for washing also. But people use it as a, yeah, decoration. I'm using yoga mat.
Fashion statement.
Fashion,
Fashion
fashion.
statement.
Okay,
Like that brand Lululemon and all.
I'm doing yoga to show to the public. He may not be doing, she or he may not be doing only about yoga. She only exercise. I'm doing yoga. And doing inside, what is going on inside, one should know. What are the benefits? What are the contraindications? That is the study of it. Yeah. Pranayama for osteoarthritis. Very easy. Brahmari, Ujjayi, Anulom Vilom, Kapalbhati, Suttani, Chitkari. Besides Surya Namaskar and effective curing the joint pains. No problem for Surya Namaskar with osteoarthritis. Why? Aswa Sanchalanasana. No problem. Then twisting outline is not there. In when you come out of now Aswa Sanchalanasana, in between the Parvatasana, no,
Adho Mukha Shwasa.
Adho Mukha Svanasana, always the legs should be perpendicular. Don't try to bend the knee in Aswa
Hmm.
Sanchalanasana. Try to adjust your hand and feet to be together.
Hmm. Means the leg in the
Otherwise,
front should be.
continuous practice of this bending of the knee in Aswasanchalanasana will develop osteoarthritis
I think
over the period of years. Especially when you teach the students, younger lot, you have to do this one. Those who are mothers, 40s, 50s, mein hai na, they absorb it very slowly, depending upon the background and all. But typical housewife रहेगा without any, you know, study and knowledge, they'll find it difficult. And you always notice that this housewife, they are obesity because of the lack of exercises and lack of walking in the morning and all. Okay. Ananumilum, Kapalbhati, Shitali, Shitkari, Surendra. Now we come to the last topic, non-communicable diseases. What are NCDs? Yoga is an essential practice to increase the physical and mental activity and prevent the occurrence of NCDs. Yoga practice can improve the function of different systems of the body, foster physiological well-being, and improve the oxygen delivery to tissue, remove the metabolic waste product, carcinogenic and cellular toxins, and scientific evidence has begun to improve emphasize its efficacy. It helps to get rid of the toxic structure which create the disturbance in the body. Okay. So what is this NCDs and common diseases? Yoga
like
practice.
diabetes and
Uh, type of
like
disease.
hypertension,
Like
diabetes.
cardiovascular disease,
Yeah.
maybe cardiovascular cancer, like
Diabetes,
chronic respiratory diseases.
What are the respiratory diseases? What are the common respiratory diseases? Asthma,
asthma, bronchitis.
COPD,
We discussed.
CPOD, chronic pulmonary obstructive disease, CPOD,
That is,
and any respiratory infection के लिए pranayama is the best. All type of Ashtapuma pranayama should be practiced. Ashtapuma pranayama, you know, I'm not telling.
yes.
And improves the oxygen renal tissues, remove the metabolic waste product, carcinogenic and cellular toxins, and scientific evidence has begun to emphasize the efficacy. It helps to get rid of the toxic substances which create disturbance in the body. NCDs continue. In this review, the authors explain the role of various yoga practices in the management of four major diabetes, respiratory disorder, cardiovascular disease, and cancer, based on the evidence from various literatures and research. NCD is the ailments that are based on the routine habits of the people. Sedentary lifestyle is the leading cause for health issues, which leads to non-communicable disease. Yoga helps the human beings to make the body healthy and fit. Helps the man to get rid of toxic substances which create the disturbance in the body. Madam, don't open the textbook. Otherwise, you'll get confused. You see the textbook and see the familiar. Forward, please. Go to the textbook. Keep it away. Then you will be able to concentrate on the PPT. Why I'm telling you? Because we have got the experience. Students' concentration divert होता है. Look at the book where it is cut down.
Okay.
Many things
Yeah,
might
I was
be
just marking.
especially the topics which I have introduced. When I have put in the book, I have
Uh-huh.
I see the maximum, but you will find when the book is open, many things will be cancelled from this topic. Okay,
Okay.
maybe to reduce the NCD related premature mortality, regular practice of yoga must be implemented. In this short review, we discuss the various role of yoga practices for the management of four major NCDs. Asanas are Surya Namaskar. The key to do a yoga posture is that it should perform with stability and comfort. Asanas had a beneficial effect on glucose utilization, fat redistribution in people with type 2 diabetes. In patients with diabetes, the pancreatic cells may be rejuvenated and beta cell sensitivity in the pancreas may be increased by the alternate abdominal contraction and relaxation involved in yoga practice. You are able to get me know what I written about because anything you can stop it with it. Improved blood supply to the muscles may enhance the insulin receptor expression in the muscles, causing the increased glucose uptake. It was noted that ideal control of diabetes was done by Dhanurasana, Ardha Matsyendrasana, Alasana, Vajrasana, Bhujangasana, and Naukasana. Okay. Yoga for respiratory disease. Yeah. Then, the regular practice of pranayama will lead to a good supply. I told you, the oxygen to the lungs. Respiratory rate becomes slower. This slower breathing will activate the parasympathetic nervous system, which helps in reducing the stress and regenerating the body. It strengthens the diaphragm and removes the impurities from the breathing tube. Okay, this is the result of the pranayama. But tell me one thing: only if he is having bronchitis, only he should do pranayama. Asana need not be done to a patient of bronchitis or to a patient of asthma.
No, no,
Or to
both
Some
are equally
asanas
important.
have to be equal because without that, how will the body also, open up and then the diaphragm and everything? Otherwise, it's very stiff. So asanas warm up, asanas
Flexibility
have
of
to
body
be
is very
done before
important.
pranayama.
a the benefits will include the Bhujangasana, Viparita Karni, Viparita Karni. Viprita Dandasana. The opposite is Tadasana. Urdhva Mukha Asana. Ustrasana. Supta Virasana. Dhanurasana. Setubandhasana. Sarvangasana. In our faculty, he is very expert, Abhinav, and this much, Saraswati. So they will be taking all the practical classes. Lungs and other respiratory organs require an adequate fresh and healthy blood supply to prevent disorders and diseases. It is obtained by the way of gravity that is inverted postures and through the method of squeezing and choking. In inverted postures such as Siksasana, Chalavasana, Sarvangasana, Halasana, Setubandhasana, Sarvangasana, Vipritakarni. I would ask you, why it is not known as Vipritakarni Asana? Why it is known as Vipritakarni Mudra?
So we could because we don't hold it.
No, no.
We hold it against the wall. I mean, initially to start with.
Why it is known as Mudra? Vipritakarni Mudra.
Maybe the bandhas happen automatically in that. We don't have to take any extra effort.
Vipritakarni
Yeah.
Mudra, unlike Sarvangasana, there is no compression on the chest, on the throat. You are able to breathe properly. In Sarvangasana, you are not able to breathe properly because of the stand, which is perpendicular to the
Chin,
throat.
yes.
Okay. That's
So
why
here in
after
Vipritakarni, we
that's
don't do
why
bandhas.
that's why after the Sarvangasana, you do the counter pose. Which is the counter pose? Matsyasana. Matsyasana. Fish posture. Fish posture, the compression which has taken place in the Sarvangasana, due to which the breathing has been affected, you counter relieve it by Matsyasana. Either in Padmasana, Buddha sit in Padmasana, take your back straight, lie down, and then with the help of both the hands, twist your head. And always remember golden principle, eyes to remain closed, come to the posture, eyes to remain closed, do the normal breathing. When your mind says come out of the posture, open your eyes. You should explain in Bible in such a way. Such a way.
Okay.
And all my students 100% they get through very good marks. It's a challenge. He knows very well. See, one common question which is very favorite to the what is the difference between exercise and yoga? Define yoga. Okay.
So in
So
Vipritakarni, we
yes,
don't
coming
apply
back
bandhas,
to
na?
Huh?
No, but the mool one takes place no automatically when we are against the wall. That अपान वायु के लिए
Mool bandh we don't close
Why,
the
why,
penis, na?
we
why,
don't have to
why
do
you
it
want to support on the wall?
explicitly.
No, why you want to support on the wall? It's for senior citizens.
That's how I've been taught. That's how
No,
I've been
we don't
taught.
That
support.
is at the starting learning stage. Wall ka
Yeah.
support. When your body is not accustomed for the toxin-turning postures, for those people, a person who is 1 month old, 2 months old, practicing, for them it is okay. And once the practice comes in the stream and the body gets flexible, then you have to start the toxin-turning postures. Otherwise, the students here teaching 1 month old or 15 days old, no, toxin-turning postures till the body has to get accustomed. Okay.
Right. So then we don't apply bandhas in Vipritakarni, na? That's what I'm asking.
They say you can apply mood bandhana. Coming to that, why it is known as mudra? The Ajna chakra which is there is directly correlated with the toe of the toe.
Oh.
Toe. That's why among the Shat chakras, the Ajna chakra gets this one.
Third eye.
Yeah. In Sarvangasana, they may not take place because of the constriction created during breathing. That's why. In Sarvangasana, you do the counter pose, but in some schools of thoughts, they say all the three Halasan, Sarvangasana, Vipritakani Mudra, और काउंटर पोज के लिए एक ही काउंटर पोज है मत्स्यासन. They'll ask you in the Viva, what is the counter pose? Which you done?
Mhm.
Yeah. Next,
And how much time should a person hold a, say, without wall support? How much time ideally would you recommend to hold a Vipreet Karnyasana?
it depends on person to person. When you are teaching a patient, no, this is very
Mhm.
far off. This is very far off. Patient, you should do all simple asanas only. This is only for a good practitioner.
For a practitioner, yes. So for us, say, sir, how much time would you recommend to start with? Like, I think without support, maybe 60 seconds or I mean, over 60 seconds I can hold.
शीर्षासन कैसा पड़ता है? शीर्षासन can anybody
Shirsasana,
without touching the foot.
no, without support. That is because since childhood, खेल खेल में सीख गए. It's not like I did it as a part of yoga. Just children na in our like we used to do Shirsasana ऐसे ही. So that आराम से 4 to 5 minutes it goes now. आराम से, not more than that, but 4 to 5 minutes
You are talking about
definitely. Yes.
children or your age. As
No,
age,
no, I started as a child. खेल खेल में like
can you
chakrasan,
maintain it?
shirsasan.
Can you maintain 5
Yes,
minutes?
yes, yes. Even Sarvangasana, ये सब खेल खेल में. I have not explicitly learned this. Like children are doing now together, we all few kids ऐसे ही मस्ती में. That way I learned. But there are asanas like Kukutasana and all that I have not attempted also.
Children are doing exercise. Children are doing exercise. Even if you teach them yoga, they will not be able to understand. Hold the breath, come to the posture. No, 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 it's not possible. That's why in yoga we say after 12 years, when all the organs start developing, after 12 years you start, the proper yoga starts. That's why children they should not teach pranayama and all. No. Children masti karo, move karo, joint loosening karo, jumping and running and all. At the age of 6, 7, 8, you know. Yes.
Huh.
Well, so
That is how kids of my age learned. When we were small, like, some girl, like, Ari, I can do this, you can do, like, that way we learned. We didn't, nobody taught us some of these things. But now when you're thinking in terms of yoga, yes, the breath control and all. But तब तो we didn't have that knowledge also कि ऐसे ही किसी ने चक्रासन किया, even I can do it. That way we learned.
okay. Next. NCD with the cardiovascular. By doing the above practices, circulation through the human body is altered and area above the heart receives an increased supply of blood, which will also be noted in last two postures mentioned, Sarvangasana and Upitaprani. Also, the additional respiratory benefit of stretching and massaging the diaphragm. Why so? The primary muscles of the respiration. Diaphragm is the intervening layer between the abdominal cavity and the chest cavity. As the breathing goes on. Huh? The process of squeezing and soaking occurs when the respiratory organ is constricted and released. CVD, very important, which is which is the contraindication for cardiovascular disease among the kriyas, among the asanas,
Among the
among the kriyas,
asanas,
asanas and pranayama.
any inverted asana will that should be avoided for CVD, or any forward bends also, like standing forward bends, because where a lot of blood goes to the brain, you can say. If supposing somebody's got hypertension or something, in that case it could shoot up the BP.
Yeah,
So I think most of the asanas would be better for respiratory disease only, unless uh, wherein you're applying Jalandhar Bandha a lot. That might maybe be a little difficult.
all bandhas to be avoided.
Okay.
All bandhas. Janandaban, Udyanban. Udyanban
Udyana Bandha is also correct.
to certain extent can be accepted, but then also the bandhas should be avoided.
So
One.
even Moola Bandha.
Moonban can be taken some school, they say Moonban can be taken, some school say Moonban has to be avoided. Most important, Kapalbhati should not be done, depending upon the patient's condition. Whether he has done angioplasty, whether angiography, angioplasty, or bypass surgery. For them, anulom vilom. Then
Brahmari
Brahmari,
was
no Basrika, no Basrika. Chandrabhyas, inhalation from the left, exhalation from the left. Kapalbhati has to be started, but with 5 strokes, 10 strokes. See the condition of the patient. See how is he gasping for breath after the Kapalbhati. No, not able to, hold the breath. So that this has to be seen. Very slow. We are seeing, slowly I'll be starting taking a old age home where we're treating the therapy many senior citizens who are sick and children they just come and throw away these old aged people. Nowadays the trend is like that. So just to have a therapeutic knowledge and study about the different types of patients. I got a chart and all, I prepare everything. How to then you do the graphical notation of the reading of the so many things I do. Okay. The decrease in blood pressure, even regression and arteriosclerosis, and combined with the proper diet and lifestyle modification. Military process can also release potentially artery clogging stress hormones. Okay. Meditation में जप जप योग निद्रा
that's a good one.
सोहम जप Ayurvedic concept of integrated approach to yogic technique. PET, MSRT, DRT, QRT, and ISRT. Cyclic meditation. Nandama Ghosh. You can tell like that. Our class, in our class, I have studied like that. Huh? I have studied from the book. Never say you attended my class and all. We are still like that. Never tell like that. I attend the management class because I'm the faculty member. I'm the empaneled there. PQMS. So when I recommend students, I may not be there, and even if I'm there, the other examiners should not know that I am a teacher. Okay, when they can reduce the potential artery clogging. Examples such as Sukhasana, Child Pose, Balasana, Varun's famous. These poses also contribute to mind-body awareness that impact the lifestyle choices, such as mindful eating and knowing when to remove your stressful situation. Poses like Utkatasana, Navasana, boat posture. Boat posture is Naukasana. And dolphin plank. Work your heart with the develop core strength. Flowing yogic poses such as sun salutation increase the heart rate, thereby reducing the resting heart rate. This helps the heart to pump the blood it needs to rest in the rest of the body efficiently. What is the quantum of the blood the body has, human body has? Quantum of blood,
5 liters.
Divya,
I really have no idea.
somewhat 5 to 6 liters depending on this. Continuous flow of the blood takes place. What is the process circulation? Can Varun tell me how the process circulation takes place?
Oh,
How
what I remember from when I
No, you might have forgotten when you studied in the school. No, it's very much.
yes. So the
Scientists have
veins carry the
Just
impure. The veins carry
no,
the
no.
impure blood.
Keep in your mind the
Huh?
picture of heart, 4 chambers of the heart.
Yes. The
Then,
auricles, 2 auricles and 2 ventricles. Left auricle, right auricle, left ventricle, right ventricle, up and
uh,
down.
and what is the wall
Maybe.
known as?
Then the veins carry
No, no,
the
1 minute,
pulmonary vein.
1 minute. What is the wall known as?
Ventricular valve,
bicuspid valve.
bicuspid. Yes,
And,
yes, yes,
and the
yes,
opening of the valve is toward downwards,
yes.
not upwards. Okay. Next, come on, Varun.
So the veins carry the impure blood. Then from the now I'll have to recall whether it was from the left auricle or something. They'll be taken by the pulmonary this vein
Heart
to the
is
lung
facing you.
for
Heart,
purification.
1 minute, heart is facing you. So this left side is your right side. Right side. Left side to the
Okay,
right side. Right, left, right, left.
okay, okay.
From the
So I'll have to
right
still recall.
auricle,
From the
right auricle,
it'll
the wall,
uh,
it comes to the right ventricle. Right
ventricle, then it
ventricle,
will go by the
pulmonary artery. Takes the
pulmonary
impure
artery
blood to the lungs.
to the lungs.
Ah,
It will
then
be oxygenated there.
how?
The alveolars will
Yeah.
absorb the alveolars in the lungs will absorb the carbon dioxide.
Uh, and
Okay, so the
it expelled
oxygenation,
out and oxygen is intaken.
yes, oxygen will be absorbed. Then from the pulmonary vein will carry the oxygenated blood back to the left left auricle, no, this side.
Left auricle.
Left, no, sir.
Yeah, but correct. And left
Left auricle.
auricle through the bicuspid wall, it moves down to the
It goes to the left ventricle. Down, it will go down.
Left ventricle, yes, that's important now. Left ventricle goes to the biggest artery in the body, aorta.
Aorta, dorsal aorta. If I clearly remember that name, DA it was. Dorsal aorta.
From the aorta, it goes to the
And
parts of the capillaries and the cells.
yes,
Cells get
and the
again
arteries
the
carry
process
back
of
the oxygenated.
again the process of impure blood takes place. Again, it comes back to the ventricle. This is the process of
Yeah, the veins. Yes, the veins will bring it back. Yes, we'll have to brush up
What
all
is the
this what
pulse
we
rate?
learned in school.
What is the pulse reading
70,
indicates?
72 is the normal pulse
Pulse
rate.
rate. What does it indicate?
72.
What does it indicate?
It's the normal. That is how many times the heart actually beats in a minute.
Heartbeat.
Palpit. Yes, heartbeat in a minute.
Okay. Now comes the main thing, yoga for cancer. Only yoga will do for cancer patient.
No, there'll be lifestyle management as well, right from the diet, the stress factor,
So meditation
sleep.
and pranayama is very important here for
It'll
cancer
be like
therapy.
a very holistic, a holistic approach towards cancer. Not just yoga and
केमोथेरेपी नहीं लेगा चलेगा?
No, that is
no, they'll
obviously
have to take.
yeah,
That
yeah.
is something they
Apart
cannot
from
leave that.
medical.
But
Yeah.
yeah, this is just a holistic management of whatever ill effects, reducing or managing the ill effects of the chemo and radiation.
Even the side effects of chemo will be managed through yoga.
See, Ramdev Baba has adopted one new technique known as Yagna therapy. Yagna Kunda में ये करके you have to close the windows and I treated a cancer patient. Okay, and then he used to go to work. So the effects of this, I joined when she was at 25 cycles. She was working Cosmos Man. In 2 3 days, the after effects of uh, chemotherapy, she was not able to bear it. So that time she used to not call me. Then what we should do the process? We have to Yagna Kunda go, then the certain mantras are there. That mantras has to be recited by or simple Gayatri Jama. Om is Arpanam. Arpanam idu. Om Purvasa. Om Tat Savidur Varenyam. Bhargo Devasya Dhimahi. Through that, that uchar should be like that. Why I am going on the topic? Because you should understand what are the alternative therapies which are going on. Then, after the kunda is completely in this month, window is open up, window. Then you start doing Anulom Vilom and Brahmani. So what happens? The intake of these oxygenated fumes, the contents of not only O2, it comes to ozone level, O3. It's a most purified version of the oxygen. It's O3, ozone. So that in that level of ozone, the intake of the oxygen, then so the alveoli starts opening up. The circulation becomes faster and faster. The recovery, what is going on inside when these fumes get are inhaled. So this is the concept which they had developed, Patanjali. So this has been treated. The certain herbs are there. For each disease, the certain herbs are there. So that they have done it through research. Patanjali Research Center, you should visit Haridwar. Very beautiful naturopathy center. It is costly, but you should once in a lifetime. I not visited, but they say a lot of things on.
So how effective was this, sir, with the patient? How effective was the Havan?
Yes, that see we cannot go every day. We taught it we for 20 days, 25 days. Then she has to practice it.
Right, right.
The side effects and the chemotherapy will not allow you to do it. The patient expired. That is a different thing.
Okay. Mm.
Ladies में breast में पकड़ता है, then ovaries में पकड़ता है.
So it also depends on what stage of cancer the patient is, na? If
Yeah,
it's in the last stage, then you can't do anything about it.
no, no, no. You should not.
No.
You should not accept it. You should not do it. That. Hari Om. Thank you, Bhavin.
No, no, not like that. It'll be difficult, more difficult. That's what I'm saying.
Yeah, yeah. Very horrible state. Let God forbid, Bhavan. You should not. Nobody should. Yoga for cancer patient to control the symptoms such as fatigue, sleep disturbances, loss of appetite, chemotherapy induced nausea, vomiting, pain in case of cancer patient. The effect of yoga intervention have been moderate to too large in the studies. You ladies both are aware about the different types of menstrual disorders. You're supposed to know
I've heard of
different types of gynecological
US.
disorders.
So the
I've heard
major is
about
PCOS,
PCOS,
I think.
OS,
Yeah, yeah.
PCOD.
Then even fibroid, I have heard some people had.
Fibroids come in the later stage after delivery and all. After.
Okay. Okay. Then PCOS is the most
I am
common
talking
which I've
about
heard.
young girls in the age of 50 when the menses starts.
Correct.
So neglect is taken place, and after marriage, post marriage, the pregnancy finds it difficult. Never delay the pregnancy when you treat a patient, when you treat a youngsters. Nowadays, everybody are busy in the lifestyle, in the work, office culture, no leave, office, hospital जाएगा, doctor gets cesarean operation, I don't tell leave and all. No time for waiting for the labor pain. And doctor does all the advantages and see that cesarean takes place. So that you will charge more. Anyway, chalo, ठीक है. These are just, when you treat a patient, when you treat a, so your, whatever has been taught by you in prenatal stage will be all effective because doctor overrules you. And ultimately, patient will more on the doctor rather than a yoga therapist. First 3 months, first trimester, basic asanas without any pressure on the abdomen. Second trimester, less of asanas, more towards pranayama. And the last trimester is only pranayama. This is the prenatal stage. Postnatal, 6 months after delivery, normal asanas to be started very, very slow. Okay. Basic. You can do the course, prenatal postnatal course. Okay. Very useful. 10 successful girls having normal delivery will be blessed by their mother and mother-in-laws. That is a divine, normal delivery, because now, if you have seen the old village people and all, they never used to go to the hospital. They used to get delivery at the home only. Normal delivery. 2-3 bike को बुलाएगा, then they know what to do and all. Anyway, this is just an interpretation of therapy matter. But my mind moves more toward the therapy. I like interaction now. Cooling pranayama. I have been usefully managing the cooling pranayama. कौन सा है?
Chandrabhedi,
Chandrabhed.
Chandrabheda pranayam.
Chandrabhed.
Then Shitali, Shitkari.
Chitri Shitkari. And in Yoga Nikata, we have one more thing, Chandra Abhyas. Inhale from the left and exhale from the left. Why we say inhale from the, why we start from the Nadi Siddhi Pranayama from left nostril? Why? Left nostril activates which system?
Left will activate the right side of the body.
Left
The sun,
nostril,
the moon.
left nostril, the Chandranadi activates which system? Which autonomous system? Parasympathetic nervous system. Opposite brain. Left nostril activates the right brain. Right nostril activates the left brain, which is sympathetic nervous
Yes.
system. A combination of parasympathetic and sympathetic nervous system, autonomous nervous system. Parasympathetic system is a seat of love, emotion, more toward this one, moving toward the sattvic way of life. That's why we start Nadi Pranayama from the left. You can expect this question why they ask. So say the seat of love and emotion, parasympathetic nervous system gets activated. And that's why we start from the write it down. You have forgotten it. If we start from the right side, what happens? More of it will be generated. One.
The sympathetic nervous system will get
Sympathetic nervous
activated
system will be
because right
activated.
will on the
Mind,
controls the left side.
the mind will move toward the Rajasic state. Mind will move toward the Rajasic state.
So I had one query here. When we do Surya Bheda Pranayam, so that time it is from the right only. We are constantly activating the right. So why is it recommended then to start like even in Hatha Yoga, the first pranayam which was mentioned was Surya Bhed.
Surya Bheda, what it happens in Surya Bheda Pranayama? Heat is created in the body. Heat is created. And
But
very
won't
good
it
for
activate
high BP. High BP is very good. Okay.
Okay, but won't it activate then the sympathetic nervous system? We are
Yeah.
constantly doing from the right.
But you have to see the patient's condition when you're doing. High BP person, you should not do it.
Hmm.
It may aggravate the blood pressure level. Okay.
Okay. And say for regular practitioners like us, should we do it or no?
That can be done. But Surya Bheda, anything doing eating pranayama should be counteracted with the cooling pranayama. Shitri Shitkari and Chandra Vyas. Okay.
So again, one more query here.
Yeah.
So wouldn't it, if we do Surya Bhedi, wouldn't it also get that Rajasic characteristics more enhanced in us then?
That's why do the cooling pranayama, no? To counter the effect that heat which is created out of Surya Bheda pranayama or other pranayamas. See, Bhastrika is not in the examination. Please remember that. But you are supposed to know Bhastrika. What is the difference between Bhastrika and Kapalbhati?
In Bhastrika, it's forceful inhalation.
Yeah. Because first thing is forceful inhalation and exhalation. Kapalbhati
Inhalation.
is only
One
exhalation.
Forceful exhalation.
So Bhastrika is forceful
Bhastrika,
inhalation and exhalation. just like bellows of blacksmith, how it was written.
Ah.
But Kapalbhati is only exhalation, and that is not
Yes.
forceful.
Forceful exhalation. It will automatically inhalation takes place. The person doesn't have to take effort.
Yeah. You made a mistake now. You told Kapalbhati is only exhalation. Does the law of
The
respiration
inhalation.
does the law of respiration states only exhalation or only inhalation? Inhalation, natural process of the respiratory system. So inhalation is passive, exhalation is active. When you talk properly. Madam, why पूछेगा question सब? Difference between Kapalbhati and this one. They first start practicing the knowledge system, they will ask. So when you say only exhalation, now they'll, is it so? Then they'll ask question like me. Then you get confused. Passive inhalation. Whereas in Bastrika, you are able to see both when in the closed eyes, when you see chest forward like this. Chest forward, chest backward. Then stomach forward, abdomen. So the rate of Bastrika which you do is much more than Kapalbhati. Kapalbhati is in a very systematic way. Whereas second question which I ask is, why do you add Surya Bendam Pranayama for Bastrika? Why you add Surya Bendam Pranayama but to Bastrika? Why you add Parul?
To generate heat. To generate heat in the body.
Yes, and
I mean, we just spoke of that.
not,
And
not only Surya Bendam Pranayama, with Jalandharman and Udyanma. With Jalandharman and Udyanma.
Jalandhar and Udyanban. Okay, that is to retain the heat in the body.
To hold the breath during the Kumbhak
Hold the
state,
breath.
so that the heat which is generated in the Kapalbhati will get reduced.
Will get.
Will get reduced. Let's see, a lot of research has been made on this. Why this one? But still, they are not covered in a substantial reasoning made. So many high researchers will not may ask you, but ordinary teachers, this, who are taking examination, they may not ask. But
So
the
how will
process
the
is
heat
that
get reduced while holding the breath? I mean, if we say spin Surya Bhedi, if I inhale from my right and I hold it with Jalandhar and Udyan, you're saying. So how will the heat get reduced in the Kumbhak?
during the Kumbhak stage and exhalation stage, part of the
Hmm.
heat which is related with the inhalation stage, in the Purak stage,
Hmm.
gets reduced. That is, study has been made. Now it's been so much details I had not, study has been done.
No, I mean, just in case the examiner may ask, like, because even I couldn't follow, like, how, why would it
I'll find out. I'll
I
find out.
also thought the heat will increase.
Yeah,
increase that? I mean,
yeah. It will increase, but after Pastrika we do Surya Bendam, Chandravas, Shitali Shitkari.
hmm, Chichili Shitkari. That is to balance that heat.
Brahmani also acts an effect of cooling prana. Brahmani acts more on the nervous system. The nerve cells and the nose gets activated. Why Brahmani में मेल हनी भी साउंड क्यों नहीं बोलते हैं? Why female हनी भी साउंड बोलता है? Why?
So
Because
female
While
honeybee is a
inhale,
queen. She's the queen, na? So it is maybe that is why it is used here.
no, but there was one more mention, I
the
think, if I recall it correctly.
मेल हनी भी का साउंड है ना during inhalation is difficult. It's difficult.
Ah, that is
Whereas
what I was saying.
during Rechak, the sound which is emanated is a female honeybee. During Rechak, the sound which is emanated is female honeybee. Okay. Next, asanas for management NCDs that can be studied now. Sugar reduces stress hormones, axis regulation, relaxation response, and improve the parasympathetic function that reduces stress and modulate the response to the stressors and install a greater control over situation. This is particularly useful in cancer patients who perceive cancer as a threat and constantly ruminate on its fears. Depression causes abnormal elevation of diurnal cortisol, leading to insomnia and immune suppression. Yoga helps in the reduction of depressive symptoms by changing the perception, thereby improving the fatigue, improve the sleep, and consequently improve response. Yoga moderates psychoneuroendocrine and psychoneuroimmune axis, thereby restoring homeostasis and reducing the anesthetic load. All pranayama is to be done without kumbhak for cancer patients. Vastrika not to be done. Okay. Vastrika create more pressure on the heart. Benefits of yoga and pranayama, but you can read very well, the such as improving physical active toxins and so on. Yoga is an integration medicine. Now this is very important. Last this one. Integration of what? Yoga is integration of what?
So body, mind, and soul.
Body, mind, and soul. Huh? Yoga and heart studies found that yoga reduces the risk factors of heart disease such as body mass index. What is BMI formula?
Uh, Body mass index. I think
Body
I
mass
only know
index.
the number. To 20, say, for a lady in the fertile period, it should be a little 25 to 27. And if it is later on, it should come down to below 23, the BMI. That is one thing which I was
BMI
just told.
best ideal situation, body, mind,
It is
and
weight related to height, na? The according to their height, how the
Yeah.
weight
18
is calculated.
kilograms. Weight in kilograms divided by height in meters square. And I write it right on the formula. BMI is equal to weight in kilograms. Write it on Parul. Divided by height in meters square. Now find out where you stand. About 25 is somewhat obese. About 30 is very much obese. Below 18 is very ideal. Below, no, sorry. Above 18 is ideal. 18 to 25. Below 18 is skeleton. Not advisable.
Yeah, but the recent study which I received, they said for women in fertile window, like till before menopause, till 27 is also okay because at the childbearing, for childbearing, they need some amount of visceral fat for the baby to be healthier.
Ah.
But yes, after menopause, it should be below 23.
Yeah.
This is what was told. So even till 27 is okay for women in
It all,
fertility window.
all depends upon the food habits which you take, the thought process which you take. So many factors are taken into account. Gossiping on the ladies, unnecessary talks, those are housewives and all. A working lady will not have much problem. They'll be busy in their office work and all. So many factors are taken into account for this BMI reduction or increase in the weight, putting on the weight. Some disease also.
There's a new concept now, skinny fat. There's a new concept now which they say skinny fat means person will be very skinny, but the visceral fat level could be high.
Okay. That means to increase the fat level, then the consumption of the food, unnecessary things will be more, fatty things will be more. When you advise visceral fat is required for this much and this much, so naturally the mind moves toward the oily things, this thing and all.
Yeah.
Anyway, chalo, ठीक है. Yoga incorporates a meditation and breathing can help improve and well-being. Regular yoga practice creates mental and clarity, calmness, increases the body awareness, relieves the chronic stress patterns, relaxes the mind, centers the attention, and sharpens the concentration. Are the opinion given by section on doctors. Yoga is the potential to increase the fat loss, develop the muscle tone, and build up the flexibility, leading to a more lean-looking physique. He says flexibility and balances are what you are after. Even the gentlest form of yoga will do the trick. Many types also help you to build the muscle strength and endurance. Yoga has been widely used for health promotion and disease prevention and as a possible treatment modality for neurological disorders. Yoga can help deepen your meditation practice, improve your flexibility, and help with the balance. Pilots will be better for recovering after injury, improving the posture, and for core strength. So these are the topics which are taken. And this is a and stop the recording.